Good evening, officers that I can see, and Louise. Hello, Louise. This is the Health and Adult Social Care Overview and Scrutiny Committee, the 7th of March. My Democratic Services Officer, Joe Tyler, is on Teams tonight due to being in close contact with someone with COVID, so we decided it was safer if he came in virtually. So, Joe, would you like to read out the housekeeping notice, please?
Thank you, Chair, and good evening, members. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. Please could everyone present follow these ground rules. Only speak when invited to by the Chair. For those present in the meeting room, please use the microphones on your desk when speaking. If accessing the meeting via Microsoft Teams, please turn on your video function before speaking. Again, if you are accessing via Teams and would like to speak on an item, please do so by utilising the Raise Your Hand feature in the bar at the top of the Teams window. For those in the room, please note that if the fire alarm sounds, you must exit the building by way of the nearest available signed fire exit route and make your way to the ground floor of the multi-storey car park. Finally, please ensure background noise is kept to a minimum and that mobile phones and other devices are turned off or switched to silent for the duration of the meeting. Thank you, Chair.
Thank you, Joe. Agenda item 1, apologies. Joe, do we have any apologies for this meeting?
Thank you, Chair. Yes, we have received apologies from Councillors Chris Matthews, Dwayne Farr and Kieran Wilson. And with item 2, the substitute members, we have with us this evening Councillor Sandra Moore substituting for Councillor Chris Matthews and Councillor Sean Gabriel substituting for Councillor Dwayne Farr. Thank you.
Thank you, Joe. Do we have any declaration of interest from any committee members? Councillor Johnson.
Thank you, Chair. I'd like to declare that I'm employed as a staff nurse at Royal Bournemouth Hospital.
Councillor Evans.
Thank you. For transparency, I'm a bank employee at University Hospitals, Dorset.
Thank you. Agenda item 4, confirmation of minutes. Does the committee agree to confirm the minutes of the meeting held on the 17th of January 2022 as an accurate record? Agreed? Yes, thank you. Agenda item 5, public issues. Joe, do we have any public issues for this meeting?
There are none, Chair. Thank you.
Thank you. Agenda item 6, action sheet. Would you like to look at the action sheet? And has anybody got any questions on that? No. I just wanted to bring up item 1110, the Home First programme. I just would like to see whether we can have an update sometime on that. I did notice that the Dorset Health panel, which is similar to ours but not quite the same as ours, they had an update on the Home First and their January meeting, so perhaps we can put that on our forward plan for that. And also 170, the carers strategy. Now, we did all receive the survey and we did have a carers strategy update meeting on the 21st of February. Now, I can distribute some notes that were taken on this, or would you like me to go through a few bullet points now? How do members feel? Go through them? Okay. Right, so they are sort of more or less as bullet points, but if you've got any questions, ask Councillor Evans. Right. 11% of carers in Dorset are unpaid. 5,300 are registered with the Carers Information Service, but there is a need to reach those who haven't registered or unaware of what services and information is available for them. Now, the pandemic took its toll on carers, with nationally 9 out of 10 saying they feel lonely. 81% of carers have taken on increased hours of care due to the COVID-19 pandemic. 69% of respondents reported worsening mental ill health, and 64% of respondents reported worsening physical ill health. Carers were asked who their cared for person was. The highest numbers are spouse or partner, followed by younger family member, followed by a parent. Valuing carers in Dorset is under review. Not all carers have all the information they need, for example, direct payments or self-directed support. Other areas being looked at are the short breaks, residential respite, CRISP, which stands for Carers Resource Information and Support Programme, the Carers Centre and Carers Skills training. The Carers Survey was sent out with 2,804 email links and 2,447 paper copies. There were 727 responses, with 131 willing to be part of a focus group. The majority of carers are spouses or partners, and they prefer the term recognised carer over any other term that's been used, e.g. unpaid carer. So they like recognised carer best. Some other feedback. The carers' assessments, 33% were not happy, but some of this was through delays or confusion over process and their rights. Majority were happy, and many don't want digital training. High numbers had a confident approach to technology. Those that were not confident preferred paper copies. Some more wanted evening events rather than day events through CRISP. And many were pleased with the BCP website, My Life, My Care. Carers would like training from mentors with tips and techniques, especially from those who have lived the experience, and many former carers are happy to do this. Direct payments was found that would help with cleaning, gardening or dog walking. And My Life, My Care was a good message, but there are needs across all services. There were lots of positives for CRISP, with ideas for promoting and steps for guidance for carers at the start of their journey. So I'm happy to distribute that if anybody would like that. Any questions? No? Okay. So are you happy with the action sheet? Yeah. Okay, so, yeah. Oh, sorry, Diana. Sorry, Councillor Butler.
Thank you. Yes, action 171, Dementia Services Review. I don't know how we're going to receive the data for that, but really we need to have a chart showing the monthly results of to monitor the target, because they were aiming at reducing the 16-week to 6 weeks. So hopefully that will be done. And action 182, have the Cabinet written to MPs regarding the carers allowance?
Did ask them to write to it, but I can check whether they have actually written to them. Yes. Okay, the Dementia Services Review. I believe we have got that on our forward plan as well, but you just want to know whether we can get someone that can update us on whether they've managed to reduce the waiting times. Yeah, perhaps that could be taken on board, Joe. Thank you. Anybody else? We move on to agenda item 7, COVID-19 update. Do we have Sam Crowe on the call here? Sam. Hello, Sam.
Good evening, Chair. Good evening, committee members. I'm going to attempt to share my screen. I just have 3 or 4 quick slides that I'll just share with committee this evening. Bear with me a second. Okay, bear with me. Is that coming through for you now?
Yes, thank you.
Okay, brilliant. So, as you know, I last came to committee in January and gave an update on COVID-19. I think it's fair to say that since that update, quite a lot has happened. I'm sure you're all aware that the national strategy for dealing with COVID has changed significantly with the Prime Minister's announcement on the 21st of February of the Living with COVID strategy. So I'll just go to the current situation very, very quickly. This is an epidemic curve that I've been showing regularly in the briefings ever since the pandemic started. You can see BCP Council picked out in the dark blue there, along with some of our neighbouring councils. And you can see back in January, when I was talking to the committee, we were right at the top of that Omicron wave. The cases then fell back. We had a bit of a rebound through February, but over the past few weeks, it does appear that the infection rates have been falling. A big caveat is that the change in public behaviour around seeking PCR testing means that it's much less reliable data now. So with the change in the need for a confirmatory PCR test, we saw lots and lots of people not seeking a symptomatic PCR test, but instead relying on lateral flow tests. Not all of those are reported, so there's less and less confidence in the epidemic curve that's produced by the testing and the positive confirmed cases. And instead, we're having to rely on the national seroprevalence surveys carried out by the Office for National Statistics. The next survey is due to report, I believe, on the 11th of March. The last date for which we had data available, based on the seroprevalence survey, suggested that prevalence in the southwest was around about 4.8%. That was on the 23rd of February. So we are starting to change the way that we report on COVID significantly. But nationally, government is assured that hospital admissions have been going down. There's been less ITU beds occupied by patients with COVID-19. And what we see locally in the hospital system is a mixture of people who are in hospital because of COVID-19, but also people who have been admitted for other reasons, but have tested positive while they're in hospital. So it's an improving picture overall, but I just need to make committee aware that we are much, much less reliant on the infection rate data that was coming forward from our testing regimen. So just a few points from the Living with COVID strategy. I'm sure you're all aware that the legal requirement to self-isolate ended. All of the regulations have been lifted. Universal free PCR and LFT testing will end as of the 1st of April. There will be provision of testing for certain more vulnerable groups. We're awaiting details of the national testing strategy that will replace what we've had to date. But the focus overall is shifting to protecting the most vulnerable and those higher risk settings where the public health team have been working with colleagues to try to offer good infection prevention and control guidance and response to outbreaks. Local authorities are being asked to maintain a scaled back response to COVID-19 as part of a wider health protection response. So our understanding is that that will include looking at other infectious diseases and hazards, working with the UK Health Security Agency. Contact tracing, as I'm sure you're aware, the national NHS test and trace system stopped as of February the 24th, and there's been a consequent impact on our local contact tracing teams. I've talked about the change in surveillance from relying on confirmed cases via testing to use of prevalence surveys. But the other point I would make is that nationally, there's no evidence of new variants in the population currently that would pose undue risk other than the two that we're aware of, Omicron BA1 and Omicron BA2. And then just a few points on what this means locally. The public health team will continue to offer a day response team to support higher risk settings, so care settings, healthcare and education, particularly education settings with children who've got additional needs. We'll still be able to access support and advice and guidance from the public health team. We are reviewing all of the national guidance as it changes, working with local partners. We will be winding up our local targeted community testing programme from the 31st of March in line with government direction. This is the programme that's been contracted out through our partners SHOSEC and has offered access to lateral flow testing for groups who may have found it difficult to access those tests from the other channels like pharmacy or national online supply. And we will retain a limited supply of lateral flow tests, really to be held back in support should we need to be investigating outbreaks or clusters or networks linked with positive cases and higher risk settings. We are working at the moment with both contact tracing teams to retain some of those skilled people in the team who want to continue with a COVID response. One of the options is to integrate those people who wish to work alongside public health into our day response team, but both teams are also looking at wider redeployment in other council roles. We'll be maintaining the Health Protection Board, which will have oversight and ongoing surveillance for COVID-19, as well as another a wider range of infectious diseases and hazards. And as I mentioned, with PCR testing, the universal testing ending on the 1st of April, one of the key issues that we need to understand still is the national clarification of how we would access testing if needed, should we be in a situation that starts to deteriorate locally. Then my final slide is really just a couple of lines about the vaccination programme. The booster programme was pretty successful in Dorset. It's now slowed in its delivery, so very many fewer jabs now being delivered in terms of boosters, but they are continuing to offer school-aged children their first and second doses. The Joint Committee for Vaccines and Immunisations has recommended a limited 4th booster in the spring for the most vulnerable groups. And the focus locally is now understanding how to shift from almost an emergency model of vaccination to something that's more sustainable. So our partners, Dorset Healthcare, are actively looking at how we build a more sustainable model going forwards. And we're awaiting more information about vaccines that will be available in the autumn. So at the moment, there's, I think it's still undecided exactly how that will come out, whether it is another autumn booster or whether there'll be newer vaccines that offer perhaps longer term protection. And we're continuing to invest using our outbreak contingency monies to keep the Trusted Voices and Vaccine Ambassadors programs going right through the spring and the summer, recognising that there are still some groups that haven't yet had their full quota of vaccinations. We think that's really a very important service to keep going. But that's my summary of the current response. It obviously happened very quickly, but we're doing our best to adjust what we do locally, make sure that we're continuing to provide an effective response to outbreaks and to support our settings, particularly focusing on those who are at higher risk. Happy to pause there and take questions from committee.
Thank you, Sam. Has anybody got any questions? Councillor Butler.
Yes, can I ask Mr. Crowe what age of children are being highlighted for the vaccine? Is it as low as 5 or is it higher than that now?
So at the moment, it's the 12 and aboves. There was a data collection exercise being started for school-aged children aged 5 and above, but as of yet, that is not government policy. So they're focusing on the 12-year-olds and over for the first and second doses.
Thank you.
Thank you. Anybody else got a question for Sam for the vaccination programme? No? Okay. Thank you, Sam.
Thank you very much.
Moving on to agenda item 8, the health infrastructure plan update. I believe we've got Stephen Killen online. Stephen, are you going to give this presentation for us? Good evening. You're on mute.
Yeah, good evening, Chair. Thank you. I should know by now. Thank you very much. Yes, I'll share my screen if that's okay. Similar to Sam. Let's see if I can just get this up. Okay, can you tell me if you can see that? Dorset New Hospital Programme Progress Update.
Yes, thank you.
Okay, thank you for having me back. I think the last time I presented was March 21, where we were still an evolving programme. It was referred to as the Health Infrastructure Programme at the time, and has been rebadged nationally as the New Hospitals Programme. And I think at the time we were preparing our submission of the strategic outline case, which went in the summer period. So I'll fill you in on where we've got to in that period of time. So welcome to our team. So we've got a mixed team across all 3 foundation trusts in the system now, led by the chief exec from Dorset Healthcare, with a sponsor from each of the trusts, University Hospitals Dorset, Dorset County and Dorset Healthcare, and strategic finance lead across the entire system, and then a program lead in each of the respective areas. So really, it is cross-trust. It is a system and an ICS response, or ICB, Integrated Care Board as it is now, and we do have a lot of executive sponsorship at that level. The programme itself, so let me just take you through the programme. It is 5 schemes, so it's Dorset wide and it covers 5 schemes. I think one of the benefits for ourselves is it is quite an advanced system in the Dorset area, and so that puts us into one of the more advanced groups in terms of the cohorts that will get funding, and I'll come on to that later on. But having the judicial review, the IOP and the Secretary of State support behind us is very beneficial, I think. And also because we've got good engagement at a system level, that's also helpful in terms of at a new hospitals programme level, looking for systems that have got a lot of support. We are one of the few in the country to have the 40 to have mental health in our scheme, so we're both community, acute and mental health focused. And part of this, it gives a programme, as well as not being a single trust, it gives wider system benefits as well. So we are talking about over 305 million of societal benefits that will come into the Dorset system on the back of this, which covers a range of gross value add through construction, increased retail on the back of that over a period of time, and also as we then complete the programme with the hospitals, efficiency through the hospitals as well. We put our case forward in August 21, and we went to what was called the Joint Investment Committee. So that's a board made up of both Department of Health and Social Care and the NHS England and Improvement national teams, and we got approval at that Joint Investment Committee as a system. So we proceeded, and we're now going into the next stage of our case. So for those that are not familiar as much as we are, there is a Treasury way of doing doing business cases, which is a 3-step strategic outline case, and in our case it was fully supported by the CCG and the Dorset system, but a strategic outline case which sets the direction for what you're going to do, an outline business case, and then a full business case. And we have now submitted and had approved our strategic outline case. We are collectively, as the Dorset system, submitting our business cases, which is the middle one, the outline business case, in the summer of this year, with the hope of getting our full business cases at the back end of the year. There's quite a lot of detail in terms of what is in each scheme now that we've got our case approved. So I'm giving a taster here of what's in each one. So at Dorset County Hospital, that's an emergency department, ITU and a community hub. Royal Bournemouth, mix of ambulatory care, paediatric outpatients, bed expansion, theatre upgrades and a new main entrance and patient visitor centre. Poole Hospital will be community hub with beds, further improvements phase D to our theatre programme, a number of significant ward refurbishments and the sterile services department's upgrade. Christchurch is about community hub and digital outpatients, and then St Anne's Hospital is about acute mental health wards and adolescent psychiatric intensive care unit, referred to as a PICU unit, which is at Allenhurst, but for the purpose of this, whilst across 2 sites, is being badged as the kind of St Anne's campus model across the 2 sites. So significant investment for our money coming into the Dorset system, and we'll be putting those submissions in very shortly. There are 4 cohorts within the new hospitals programme. So this is at a national level. First cohort are the kind of in-train, very significant schemes that needed urgent support, and a number of those were schemes that were stopped primarily because of Carillion and other things that held up progress. So they are cohort 1. Cohort 2 are the schemes that are ready to go and can deliver quickly by 2024, and we're in that cohort. So it's really great news for the Dorset system to be badged in that cohort for all of our schemes. And we're starting our initial reviews now. So we are working with the new hospital programme and the regional colleagues in NHS England and Improvement to start reviewing our cases now through to March, end of March 22, with the plan to submit our business cases by the summer. And then this on the right just gives a taste of what we can expect to see. So the top one is the new artist's impression of Dorset County Hospital's ED and critical care unit. The one on the left is the new main entrance and patient visitor centre with the new big beach building in the background, which you might recognise from other presentations. And then the bottom right is the artist's impression of the PQ campus on Allenhurst, as I said, referred to as the St Anne's campus scheme. So we've got kind of a number of schemes within Dorset Healthcare. There's this one that's shown, and then there's also the mental health wards, 2 wards on the St Anne's campus. We haven't yet finalised our business case, so we'll be in the process of finalising that outline business case, as I say, by the kind of aiming for a target submission in June 2022. And really happy to come back, Chair, and talk in the future about that submission as we get it over the line. But really, it was just to give you a taste of where we've been for the last few months. And I think that was my final slide. So, Chair, back to you. Thank you.
Thank you. Can I just make a comment? I find the term new hospitals a little misleading, and I think some of the public do as well, because it's almost like we're going to get 5 new hospitals, when actually it's probably hospital improvements rather than new hospitals. I expect you've come across this.
It has been said, Chair. I have to say it has been said before. I think the previous incarnation of the programme was the Hospital Improvement Programme, or the Health Infrastructure Programme, the HIP programme. It did get rebadged as the New Hospital Programme, and within the 40 there are a number of new hospitals, but within the Dorset system it is, whilst there are new wings and new aspects to that, it is also refurbs and improvements to our existing. So I think your comments are noted.
Thank you. Members, got any questions? Councillor Johnson.
Thank you, Chair. And thank you, Steve. Could you let me know when the new build at Royal Bournemouth will be finished, please?
The new build, as in the not part of the new hospitals, but the big building that's going on, will be September, October 2024.
Lovely, thank you.
Anybody else got any questions? Councillor Butler.
Yes, can I ask the Dorset County Hospital, for people living in Dorset who would find it easier to go to that hospital rather than Bournemouth, would that be possible for residents?
Absolutely, Councillor. I think patients have patient choice at the moment as to where they want to go to. Ambulances will make decisions based on the severity of the incident and the nature of the call out, but absolutely there is patient choice, and patients will have that, continue to have that choice in the Dorset system.
Thank you.
Thank you. Anybody else got a question? Councillor Moore.
Sorry, I'm messing up my audio there. Yeah, it's not part of this presentation, but can I ask, I'm almost frightened to ask the question, what's happening with the A&E business? We were going to have the upgrade. Which sort of phase is that coming in?
Sorry, Councillor Moore, are you referring to Poole or Bournemouth or Dorset County? Or could you give me a bit of a steer?
Yeah, it was Bournemouth was getting an upgrade for the A&E because it was closing or being changed in Poole. So I just wondered when that was going to happen.
No, so I think that was the answer to the first question that I was asked. In October 2024, the ED for Bournemouth will move into the new building, and we'll have an ED that is larger than both our current Poole and Bournemouth, significantly larger than both Poole and Bournemouth put together. and at that time we'll maintain Poole for another 2 years as an A&E, consultant-led A&E, and then after that we will continue to have a Poole service 24/7 as per the clinical services review, and as I've said to friends and colleagues, I live in Poole. For the majority of things that my children playing football at Whitecliffe or whatever, I will still continue to take them to that Poole service in the A&E at Poole. So hopefully that answers your question.
Yeah, that does. Thank you very much.
Thank you. Can I just ask, you had the artist's impression of the entrance at the Royal Bournemouth Hospital. I have been to the hospital back and forward with an elderly parent recently, and I get very confused as to where to park and everything now because there's sort of so much building going on. But in the new build, I had noticed that patients were coming out of the ambulance, and if it was raining, they were getting a bit wet. I mean, is there going to be an undercover place for when they take the patients off the ambulances in the new build?
Yeah, so and I can share that at a future if we'd like an update, Chair, on the existing, and I didn't present on the existing because I was focused on the new hospitals, but if you'd like me to give an update on that. But yes, there's a covered walkway that extends from the ED or from the emergency department that the ambulances will reverse onto, and then as they come out, patients will be undercover until they go into the building.
Okay, thank you. Has anybody else got any questions? No. It's all very exciting having all this money spent locally, which is nice. Yeah. So yes, I think we look forward to the next stage of cohorts 3 and 4. I presume it will be.
So, Chair, just to say, no, we're cohort 2. So cohorts 3 and 4 are other systems in the country. The fact that we're in cohort 2 means we get all the money over that next period. So it's so all of the Dorset schemes are cohort 2. So which is just a great news story because cohorts 3 and 4 are potentially between 2025 and 2030. So it's good news for the Dorset system that we're cohort 2.
Oh, so yes, so we're getting all our improvements very early on then. So yeah, that's great news for the area. Yes, okay. If no one's got any more questions, thank you, Mr. Killen, for that presentation. Yes, we should look forward to one sort of later in the year, perhaps or perhaps next year, sort of seeing how it goes with all the building work and everything. Thank you. I just wanted to remind the committee that we would have had the suicide prevention plan tonight, but this is now going to be possibly heard in May as the reports and the plans timelines sort of fit in better with that meeting. So we'll move on to portfolio holders update. Now we've had apologies from Councillor Rampton who can't be here tonight. So we call on Councillor Mohan Iyengar to give us an update on his portfolio.
Thank you very much, Chair. Thank you, members. I've only got a short update to give you this evening because some of it would have overlapped with Sam Crow's presentation, so I won't repeat any of that. But I think you got from Sam and I, of course, work pretty closely together, and with my counterpart Peter Wharf over at Dorset Council. And just I think the summary you got from Sam's presentation is that it's a chalk and cheese, isn't it? From the full-on vaccination program that we had before Christmas, then suddenly on December the 31st, to say the least, the pressure from central government was off completely. And of course, it didn't mean that the vaccination stopped, not by any means, but it did mean obviously that the targets, the intense targets, and the focus was somewhat eased, and the capacity and the scale of that has reduced somewhat. And just what Sam and I and some others are now thinking about and working up, and I'm lending my support to, is what does COVID management for want of a better term. What does that look like now in a slightly more sort of, I hesitate to say steady state, but whatever the right term is, what does that now look like with the possibility that people will have to have regular vaccinations for this going forward in a similar but not identical way in which people have flu jabs right now, and that's being worked through. So more news on that to follow. The second thing, I've got 3 points. One was about COVID. The second thing was about the budget, and of course, at last full council we approved the budget, and one item within that, which didn't particularly need any talking about, is the approval of the public health budget for fiscal 22-23. That went through. There's nothing particularly to talk about it, and so on. And I'd like to say I think Sam got everything that he wanted for. I know Sam's on the call right now, so Sam, do raise a hand if you think I've skirted round anything. But there's it's sort of nothing was cut off that budget. So going forward, we can do what we were doing in the previous year, and there's also an element of because of the underspend that happened during fiscal 21-22, some of that can be carried forward. Of course, it's a one-off only, and some of that can be directed to the most urgent and important needs. One of them being vulnerable children, for instance. So that's in a sense a good news there. The third thing is a more general point, which is about the emergence of what's called the Dorset Integrated Care System. And this is from national government and around the country. Members may know this is what will be superseding the CCGs, the clinical commissioning groups. We have a new chief executive in place, Patricia Miller, who's an independent, who will be chief exec of the ICS. Met her a couple of times, and obviously we're beginning relationships there. Not just myself, but Karen Rampton, but also Drew Mellor, Graham Farrant, and the relevant lead officers in health and social care, and of course in children's as well, and of course our counterparts in Dorset Council as well. We're trying to literally see how we can most productively have those discussions together. And if I can just go into a couple of details, I'm sorry you don't have papers on this, everybody, but I'll try and keep this succinct. Is that what's called at the very most senior level, what's called the Integrated Care Board, which is chaired by the chair of the ICS, and particularly will predominate with the sort of health professionals on the IC board, and particularly be about sort of the money coming down from the Department of Health, not least. And the level below that is what will be called the Integrated Care Partnership. And as is implied by the term, this is where we're in discussions now with various people as to what the makeup of that partnership will be. And I think there's a lot to look forward to in this, very positively, about how multi-partners, which include local authorities and other more specialist care providers as well, in the broadest sense, this is, in the community, can have either a seat at the partnership or a role, an influencing role into the partnership to actually make sure that we've A, got joined up solutions, and B, that we are pursuing that kind of most difficult but worthy thing, which is almost intervention before the front door. So before the person actually ends up in hospital or ends up in the doctor's surgery with something most unfortunate, actually we've collaborated to actually intervene earlier in that person's life to try and actually sort of put that person on a more sort of a healthy path. And that's where a lot of work is going on right now, I have to say. So please, I'll stop there. I don't want to take too much time on what is rather a general message, but wish us luck with that. I'm very happy to take questions, but this is something I think I and Sam and others will be able to give you a much more detailed briefing on in the months ahead. Thank you, Chair.
Thank you. Members, any questions? Councillor Evans.
Thank you. I know this isn't Councillor Iyengar's portfolio, it's Councillor Rampton's, so I don't know if he'll be able to answer, or perhaps one of the officers could step in. But it's about the recent announcement that Dorset Council are stepping away from Tricuro, and just a bit more information about that, please.
Okay. Thank you, Councillor Evans. If I may, I don't think I can answer that question. It's only because obviously it's big, and you know there are obviously it's something where there are sensitivities in the discussions. I've not been directly involved in those conversations, so I'm hesitant to give a view, and I apologise for that. But I just don't want to mislead the committee. If that's okay, please, Chair.
Thank you. Yes, I think Phil Hornsby's got his hand up. Phil.
Thanks, Chair. Yes, very briefly, Dorset Council have recently made a decision that they wish to set up their own care company, Care Dorset, and transfer the Dorset-based services into that company from Tricuro. BCP Council is still committed to Tricuro and has sent a letter of assurance to Tricuro, and there's a statement which may or may not reach the media, which all councillors should have received. If they haven't yet, they will. That sets out that position about our confidence and wish to continue working with Tricuro to both sustain current services and develop new ones as opportunities arise. So I think that's the general message, Chair. Unless there's not really much more specific. There's no change for BCP Council or its residents, people who receive services and their families, or the staff who work in BCP services. There will, of course, be the inevitable separation of the two component parts of the organisation, so that Dorset can. There will be staff who transfer into the new company, of course. So we are working with Dorset Council to both understand their timelines and what that impact is and how we deal with that. But that's likely to be quite a way into the year, probably the autumn. Thank you, Chair.
Thank you. Anybody else got any questions? Councillor, I can't remember your name. Councillor Jones, sorry.
Thank you, Chair. Yeah, just coming back to what Phil says, do we know what the reasons are for Dorset Council stepping away from Tricuro? Reasonable reasons?
Is it all right to come back in, Chair?
Yes, that's fine.
No, we don't have. It's there. I think in their statement they've said they just want to have more control. They're geographically and demographically different to the BCP area, and feel that by setting up a separate company they can focus their attention on the Dorset area. But really, we'd have to ask Dorset for their decision and consideration of making that decision. It's not really something that they've shared with us.
Okay, I mean, this could be an opportunity for BCP, couldn't it, really? I mean, it's should separate out there. I had a couple of questions, but I'm not sure who would be able to answer them for me. And perhaps Councillor Iyengar. One was on the setup at the Village Hotel for the patients that were put across there to free up some beds. Do we know, is that still operating, or is that sort of shut down now?
I'm sorry, Chair. I don't know. I don't know the answer to that. I notice Betty's on the call. If I may pass to Betty.
Thank you, Betty.
Thank you.
Yeah, thank you, Chair. Yeah, it is still up and running. We're planning to have it in place until the 31st of March. So at the minute we're looking at assisting those people that are there to go on to their next journey in a planned and safe way. So that's the latest position. Is that okay, Chair?
Yes, that's thank you, Betty. Anybody else? No. Thank you, Councillor Iyengar, for your update. We move on to agenda item 10. Can we first perhaps bring in Louise Bate from Health Watch, who's going to be giving us a brief overview of their projects this year. Thank you, Louise.
Thanks, Chair. we've been planning our work programme for the coming year. So the way we go about doing that is I work with our steering group, which is made up of volunteers, and we look back at all the feedback we've gathered through the year. And then we look at different programmes that are going on locally and nationally, so that we make sure that we're working on areas where we can have the most impact for local people, really. So the three projects that we're going to be focusing on this year are dentistry. As you'll know, we published a report about access to NHS dentistry a few weeks ago, and the government has said that they're putting in new funding. It's time limited up until the end of March to help give people more access, but I think there's a real opportunity for us to keep working on this project, especially with the establishment of the ICS, and they will be taking over the commissioning of dentistry from next year. So it's a good opportunity for us to work on that this year, so that we can have some kind of an influence on the way that's taken over in 23. The other two projects that we're planning to work on are carers. We're going to be doing some more work around carers. This month we'll be doing some phone call interviews with carers who've had experience of home first. So where carers have had the person that they care for leave hospital and get support through home first, we'll be finding out what that experience was like for them. This is part of a project that we're working on with Dorset Healthcare and with Dorset Community Action as well. And so we'll that's a short-term project that finishes up in April. And I'm hoping that that feedback that we get from carers will lead us to do some further work throughout the year to, and as you were saying earlier, Chair, to try and improve some of those issues for carers around sharing the benefits of being registered, making sure carers have appropriate kind of support really in the community. And the other project we'll be working on is access to GP services. So this is another one of the top issues that people contact us about. And we'll be focusing this year on children, young people and mental health within that. So we've been involved in some preparatory work for the Boscombe Hub, which, as you know, is going to be looking at kind of supporting people with low-level mental health issues to try and help kind of their access to care and help access through GP services as well. So, so those are the three projects we're planning to work on this year. We'll also be following up on some of the other work that we've done. So our Young Listeners project and the A&E project work that we've been doing. We'll be publishing a report at the end of this month about phone call interviews that we carried out with people using A&E services at Dorset County Hospital. And so we'll be following up on that project too. I think the other thing that we've been working on for the last few weeks is getting some doing some face-to-face engagement with people around their access to non-emergency patient transport, so the ESEC service, because the CCG have been carrying out a survey. So we wanted to go and do some face-to-face engagement just to kind of get some more views into that, because that contract is going to be up. I think they're putting that out in July and looking to get a provider next year. So just to our work will kind of help plan for that contract. I think that's roughly everything we've been working on. Did anyone have any questions?
Members, have you got any questions? I have to say, Louise, I did get contacted by email to see whether I would take part in the Home First. So I'm just waiting to see if it goes on to something else so I can answer your survey then.
I'm glad. So we're planning to start the phone call interviews for that project, hopefully the end of this week. And I think we've had around 70 people get in touch who want to take part in that. So yeah, it'd be really interesting to see the feedback. And obviously I'll share that with you when we've carried out that project.
Do you have a question?
Not a question, just a comment. It sounds absolutely fascinating. I think these are absolutely what the general public are really interested in, finding solutions to, not just highlighting the problems. And I think we'll really look forward to hearing what you come up with. Thank you.
Thank you very much.
I know Councillor Jones had brought up about dentistry quite a while ago, and it's been a subject that we've been having a bit of a struggle with. So I think it's a national problem, isn't it? So I think, as you say, perhaps we could look at it again when it's under the integrated care system, sort of see if it works any better then. So I think if we put that on our plan, Joe, sort of move it a little bit more into perhaps next year's sort of area of the plan. Has anybody got any questions about the unpaid carers, the home first, or the access to GPs? Any comments? No? No? Okay. Well, thank you very much, Louise.
Thanks, Chair.
We shall look forward to the results of all your surveys.
Cheers.
Right, if we move on to our forward plan. Has anybody got any questions on any of the items on our forward plan? No? No? Anybody want anything moving up? Or Councillor Butler?
Sorry. Thanks, Chair. Yes, the Think Big project. That's the NHS assessment clinic, isn't it, in Poole? I had a personal email about that, about figures that the number of people that they'd seen, but I don't know whether we're going to get a regular update on that. So it would be probably quite interesting if we could have that. That was point number 15, page 23. I don't know what date we can have that updated.
Thank you, Councillor Butler. We did have Sally Sandcraft on our call. Is Sally still there? Sally, are you able to give us any sort of idea of any date? I think we've got you down for doing a verbal update on that. Don't know whether you can help us there.
Yes, evening everyone. I'm not directly involved in that programme of work. I know it's very live and they've been evaluating the experience of people using what's now called the Health Village. So I'm sure colleagues would be more than happy. My colleagues, Ash is our lead. He'd be more than happy to come and give an update to the committee at a time that's convenient for you.
Yes, I mean, I don't know, we'd have to look at our agenda setting for our next meeting, but certainly if he could give us an idea as well as to how ready he would be. Our next meeting is in May.
I think they would be ready, Chair. I mean, they're
Sorry, did you say they would or wouldn't?
They would be. I'm sure they would be. They're already doing quite a lot of presentations out to a number of partners. So that's Ashley Boreham in the CCG. Joe.
Okay, so perhaps, you know, our agenda's not too full for the next sort of meeting. It could be added there. Has anybody got any other questions on the forward plan? Councillor Evans.
Sorry, quite a few, I'm afraid, Chair. So first off, we've talked about Tricuro and the challenges and opportunities it might be facing imminently. So I would very much like Tricuro to come and talk to us and perhaps explain what's happening when they've got a bit more detail and can give us reassurance that, as Mr. Hornsby said, services aren't going to be altered, staff aren't going to become unemployed, and we are still going to look to the future and see how we can provide the best possible home care for our residents. So yeah, Tricuro for one. With the Think Big project, it's obviously it's been put in place to address the horrendous waiting times we've now got in the NHS for people waiting for elective care. And I think that's something we might want to have a look at as well over the next year to make sure things are improving, numbers are falling, and people are being supported whilst they're waiting in this sort of limbo land as well.
That could probably go along with an update on the one that's been set up in the Fields building.
Yes, that's the big project.
How that's part of the big project. Yeah.
So all in one kind of thing there. And lastly, I don't know if everyone got my email about health inequalities and how we can add value as a scrutiny committee to looking into what our issues are in BCP. We obviously voted at council last month on upholding the Marmot principles and addressing the social inequalities that drive health inequalities. And the LGIU have published a very helpful paper with some questions that we could possibly look at and think about answering. Obviously, it's not just BCP Council, it's the Health and Wellbeing Board, it's working with the NHS, with CCG, obviously, fire, police, third sector, everyone. So just something to maybe start having a look at and think about how we can progress that and actually come up with sort of a plan of action rather than just a plan of upholding principles.
Has anybody got any questions on that? I think the health inequalities is quite a big sort of subject, and I think we really need to restrict it more to what this panel does rather than go into, say, education or housing and things like that, because that's all part of it as well. And I do believe Dorset are sort of doing theirs as well. And they've set up an information and intelligence service to get a better understanding of the population. Oh, Sam, did you want to sort of speak on this? I see you've got your hand up.
Thank you, Chair. I think I agree with the idea of trying to scope this because it is a huge topic. As Scrutiny is often concerned with looking at provision of local health services, the NHS is really just starting to think about its health inequalities programme. So it might be that a presentation from the Health Inequalities Group, which is starting to raise awareness and develop a strategy, would be helpful for committee in starting to look at the understanding of this issue. And then I think the second opportunity is following the progress of how we develop the integrated care partnership strategy. Mohan's update was very good at setting out how the landscape around the integrated care system is going to change. One of the first strategies that will be developed will probably have quite a theme around inequalities in health and inequalities in health outcomes within it. So again, it might be helpful for committee to hear about the development of that strategy at some point. So just a couple of early thoughts for the forward plan.
Thank you, Sam. So anybody else got any ideas on that they'd want to put forward? Perhaps you'd like to think about it and sort of let either myself or LJ know sort of what you'd like to sort of see with that. Yeah, as I say, it's a very big subject, so I think we just need to narrow it down a little bit. Anybody else got any other questions? Councillor Butler.
Yeah, can I just say that it is a very big subject and affecting physical and mental health. And I think that COVID has actually highlighted the gaps and needs of people, and it's also highlighted how isolated some people are. And I think that's a big one. I think some people have been fearful and still are of going out and mixing with people, and that's something that we're going to really have to get over. And also, of course, fuel prices are going to have a knock-on effect as well on everything. So everything has moved a bit further forward, I think. So it's very timely, I think.
I think you might find it also coming up in the carers strategy, because sort of looking at some of the figures, they did feel sort of worse off since the pandemic as well, you know, and that's a group that often do feel isolated as well. So has anybody else got any questions? No? Okay, well, I think we shall close there then. Thank you very much for everybody online. Thank you for the people here in the room, and good night.